Hello, let me tell you about the treatment of premature ovarian failure. The treatment of premature ovarian insufficiency is aimed at helping those women who cannot become pregnant due to reduced ovarian reserve, in cases where it's impossible to get eggs of good quality during stimulation in the IVF program. Rejuvenation of the ovaries also allows you to get mature eggs for fertilization without the use of expensive hormonal drugs. For many, ovarian rejuvenation is a chance to get pregnant and have a child of their own rather than using a donor egg. Another important aspect of this procedure is an extension of women's youth and preservation of her health. It's known that the natural hormonal background protects women's body from aging and many diseases. For treatment of early menopause, hormonal drugs are used. Only in our clinic, we treat early menopause, restore the natural hormonal levels without drugs. Early menopause, or premature ovarian insufficiency, is a condition in which the ovary supply of women disappears in women's ovaries. A synonym for early menopause is a decrease in ovarian reserve. Currently, it's believed that women are born with a certain stock of eggs, which are gradually spent during the reproductive period, the time during which a woman is able to become pregnant and successfully bear a child. How many eggs each woman has depends on genetic factors and on environmental exposure. The laying of primary eggs occurs in the prenatal period in the fetus from 3 to 8 months of gestation. Then the primary oocytes freeze until puberty. With the onset of puberty and throughout the reproductive period, follicles that contain an egg cell ready for fertilization mature in the ovaries. The maturation of the follicles is regulated by the pituitary hormones. The follicles, in turn, depending on the phase of the monthly cycle, produce estrogens, progesterone, and a small amount of testosterone. As soon as the egg supply in the ovaries of a woman exhausted, deep changes begin to occur in the body. The cyclical fluctuations in hormone stop. The levels of estrogen and progesterone become lower. The level of pituitary hormones becomes higher. Initially, menstrual irregularities develop, and after a certain time, amenorrhea occurs, no menstruation. In most cases, this occurs in women after the age of 45 years. In those cases, when the described processes occur in women under 40 years old, they speak of early climax or menopause. If menopause develops at an early age, there are many complications that can significantly impair the quality of life. Changes that occur with premature depletion of the ovaries, decrease in ovarian reserve, can be divided into two groups. The first and most obvious is infertility. A woman whose ovaries are devoid of eggs cannot become pregnant. The second group of changes, a decrease in the natural level of female hormones. Women with premature menopause are at higher risk of premature death, osteoporosis, joint diseases, cardiovascular diseases, psychosexual dysfunction, and of course, this affects the appearance. Aging comes more aggressively, considering that many women want to give birth to children at the age of 35, and at a later age, the problem of early menopause becomes an insurmountable obstacle to the development of pregnancy. Even IVF procedures are not able to grow eggs if their reserves in the ovaries have dried up. In such cases, they resort to buying donor eggs, to surrogate motherhood, or to adoption of children. In the same cases, where there is still hope, women are forced to repeat IVF attempts several times, while receiving doses of hormones many times higher than physiological levels. When pregnancy is not a goal, many women with amenorrhea due to premature ovarian depletion are forced to receive hormone replacement therapy to improve well-being and reduce the risk of diseases associated with early menopause. In order to solve this problem of early menopauses and premature depletions of the ovaries, there is in our clinic for the first time in Ukraine the procedure of rejuvenation of the ovaries is performed. As a result of this procedure, women start to have their periods, the eggs begin to maturate, hormone levels return to normal. There is no necessity in medications and hormones for the treatment of early menopause. Restoration of ovarian function treatment of early menopause is successful in 70–75% of cases. To restore ovarian function with a decrease in ovarian reserve, we use their own human blood cells, platelets. Platelets are contained in the blood, and their function is to regulate blood coagulation, as well as to the regulatory effects of the recovery of tissue damage. Platelets are known to contain numerous growth factors. There are more than 30 of them, some of which are well known and described. For recovery purposes, platelets extracted from human blood have been used for a long time in sports medicine, traumatology and cosmetology. With the introduction into the ovary of platelet concentrate derived from its own blood, there is a massive release of growth factor at the injection site. Under the influence of platelet growth factors, dormant eggs in the ovaries are activated. Derived from the dormant state, eggs begin to divide and give rise to follicles that become susceptible to elevated levels of pituitary hormones FSH and LH. Under the action of FSH, the follicle begins to grow and its hormonal function starts, the same as in young women. In the future, the ovary begins to function in the same way as before menopause. Platelet growth factors are regularly produced throughout a person's life and are used to repair damaged tissue. You all have had the opportunity to see how this works. Have you ever ripped off your knees? Remember how in place of abrasions, after a while appears yellowish liquid. This is blood plasma, which contains platelets, growth factors, blood clotting factors and leukocytes. This yellow liquid helps to stop bleeding, form a blood clot, protect against infection and heal. At the end of this process, the damage is overgrown with a new skin. Platelets and growth factors secreted by them are natural components of the human circulatory system, and therefore there are no negative side effects in their use. Since the procedure takes its own platelets, there is no danger of allergic reactions or infection with blood-borne infections. The method of treating platelet-rich plasma has been used for a very long time and widely in other areas of medicine. So it can be said with confidence that use of platelet is absolutely safe. The process of rejuvenation of the ovaries occurs in two stages. At the first stage, venous blood is collected from the patient. After several cycles of centrifugation in a special tube, platelet concentrate is obtained, dissolved in the patient's own plasma. The process of obtaining platelet concentration for non-pharmacological treatment of premature ovarian depletion is carried out according to a special technology patented by us. At the second stage, the plasma enriched with platelets is injected in certain places in both ovaries. Injection is carried out by a gynecologist with a special ultrasound-guided needle. The patient is immersed in a 10-minute medication sleep. The procedure takes place on an outpatient basis and takes about 1 hour on average. After the procedure of rejuvenation of the ovaries, there may be a slight pulling pain in the lower abdomen, which disappears in 1–2 hours. After the procedure, the patient remains for 1–2 hours in the clinic for observation. The procedure for rejuvenation requires a number of conditions. These conditions are age over 35 years, no periods or irregular cycle for 3–6 months, presence of at least one ovary. Contraindications for this procedure are current and developing oncological diseases, chronic pelvic pain, chronic inflammatory diseases of the appendages, pregnancy, adhesions in the pelvis, taking anticoagulants, drug and alcohol addiction. Before the procedure, consultation of our gynecologist is obligatory. During the consultation, an examination and transvaginal ultrasound is carried out to assess the availability of the ovaries for manipulation.